Hello everyone, we are from Team Bytrix, where our problem statement is digital contact tracing and screening tool for MDR pathogens in hospitals. We present InfectioNet AI, a smart MDR infection control system. Our idea focuses on fighting one of healthcare's challenges and multi-drug resistance infections. InfectioNet AI is an AI-driven IoT platform that continuously monitors hospitals, predicts MDR risks, and traces exposure, automates disinfections, alerts staff, and ensures full compliance all in real time. Now I will explain how it works. It works based on real-time monitoring. Like IoT devices track temperature, humidity, air quality, and UV exposure across the hospital rooms. And the second one is AI risk prediction. In AI risk prediction, the system analyzes the sensor and patient data to calculate infection risk and outbreak probability per ward and per ICU in the hospital. Third one is contact tracing. Like it maps patient and staff movement to trace the exposure chains instantly. Fourth one, autonomous disinfection. When risks cross safe limits, the system trigger smart sterilization automatically. Fifth one, alert system. Real-time visual and audio notifications help staff to act immediately. Sixth one is compliance and audit. Every event is recorded in a blockchain style log, ensuring data integrity and regulatory adherence. Now I will explain how it addresses the problem. By combining AI prediction and IoT monitoring, our system detects infection risks before they spread, shifting hospital from reactive control to proactive prevention. It also automates disinfection and compliance tracking, reducing manual errors while ensuring hospitals meet global health data standards like HIPAA and GDPR. Now I will explain innovation and uniqueness. Like in what's unique in our project. Our innovation lies in its multi-layered intelligence. One is AI-powered prediction to detect MDR threats early, real-time IoT monitoring for environmental and device tracking, autonomous disinfection triggered intelligently by AI thresholds. Fifth one is AI visualization showing live infection hotspots and spread maps. I will show this in our prototype model. And blockchain style compliance ensuring every event is transparent and tamper proof. Now I will explain technologies used here. We used technologies like this system built using React and TypeScript on front end and Node.js with REST APIs for the backend. PostgreSQL manages structured hospital data while MQTT and WebSockets handle IoT and real-time communication. Visualization is powered by Chart.js. AI analytics use Python algorithms, and AR features are created using SVG and animations. Security is ensured through blockchain style audit logs and role based authentication. Like I will explain implementation and the process in our prototype model. Now I will explain feasibility and risk management in our project. Our idea is technically and operationally feasible using proven and scalable technologies that easily integrate into hospital workflows. To address challenges like data privacy and integration, we use encryption and de-identification. HL7 and HL7 APIs and HIPAA compliant protocols are ensuring reliability and compliance at every level. Now I will explain impact and benefits. The impact and benefits of this project are this implant impact spans across every level of healthcare, like hospital staff. Hospital staffs can easily make faster decisions and timely alerts. Second one is patients. Patients will have safer environment and lower infection risks, and hospital management can have reduced costs and improved compliance. Healthcare networks, scalable monitoring, and early outbreak detection. Overall, it delivers social, economic, environmental, and technological benefits, making hospitals smarter, safer, and more sustainable. So, InfectioNet AI is not a project, it's a vision for infection free hospital. By combining AI, IoT, AR, and blockchain grade security, we are transforming infection control from manual reaction to intelligent prevention. Thank you. Now I will explain our prototype. Like InfectioNet AI, this is the home page. It contains administrator, home, dashboard, devices, analytics, and admin pages. And I will go to the dashboard. Now let's see the dashboard. In dashboard, we can see advanced system dashboard. It shows online devices, active alerts, safe zones, and system health. Now we are implementing a 10 IoT devices that will detect the temperature, air quality, and status and UV intensity of the particular room, like ward, ICU in the hospital. Now we are implementing AI risk analysis, like in a particular hospital, in particular room or ICU, what's happening will is detected by the our IoT device, and it is analyzed by the AI. It is showing like real-time analysis. Now I will show how IoT devices will work based on air quality and other other things like air quality, temperature, UV intensity, and status. IoT devices will show the present real-time analysis. Like if we can use active disinfection for particular room, like now I used active disinfection. It is disinfecting there using our IoT devices. Now I will show how recent alerts will be recorded by our web page. Like in ward 4a, it is showing elevated infection markers. Like we are getting recent alerts, real time alerts for particular room based on what happened, like air quality, disinfection, and high MDR risk detected, like this. In we have digital twin hospital map, like in which room how much percentage of infection is having, like what is the risk analysis of each room based on the color. If it is green color, it is safe, yellow color, it is caution, and red color, it is critical, we need to take the action, like that. And it is showing edge cloud sync. It means it shows the latency and the packet loss and the sync rate. If it is more than 80% sync rate, it is very good. It's showing proper output, like that. And our AI prediction is based on the data which is obtained by the IoT devices. Now I will show the advanced AI. We use more AI algorithms to predict the proper output, like pathogen evaluation predictor. It will predict the mutation of the pathogen. And AI confidence, like AI confidence is a 92%, and it based on the confidence it shows the what is the present evolution of the pathogen. Now I will show if consider one of the we can use autonomous disinfection AI. We can implement autonomous disinfection. Like I will show, we can press manual trigger. It will start UV sterilization for particular room, like in for 10 to 12 seconds. After the 12 seconds, it shows like room, particular room name, like room 12 sterilized successfully. And risk, if it is not properly sterilized, it shows risk triggered disinfection, risk exceeded the threshold. Now I will show the hospital network, like in what happened in other hospitals. They are using the same software, like in other hospital names, like infection risk, uptime. Uptime means from how much time our device is working, and active devices in that particular hospital, like that. And we can show AR room view. AR room view means we are putting in we are putting a camera in the room. Based on the camera movement, we can see what happened in particular bed or particular, even the water jug. We can, if we want to disinfect that using the manual trigger, we can disinfect the particular table or particular jug. Now I will exit the AR mode. Now I will show security. Security is always important. Consider if some we are using this IoT device based on some IP address and all. What if someone connect that a device using another IP address and all? Now I will show how to prevent that using our cyber security monitor. We have to we have to use initiate lockdown protocol. It will show like this: unauthorized IoT being detected. Based on that, now I can lockdown protocol is activated. Now I will lift the lockdown. Now it's stopped. Now he will his connected device will be disconnected. Now I will show what happens in analytics. Analytics is very important. So our AI analytics shows that infection risk trends in a week, and adaptive AI insight shows that in what happened in particular room, like from morning to evening, what happened, like that. We are using adaptive AI insights. Now I will show outbreak timeline in from one week one to week two. How many are affected and how many are prevented, like that. In for whole month we are calculating the outbreak timeline. And the third one is a ward level risk heat map. Based on the ward level, we need to, if we are using risk heat map, we can easily use the IoT devices based on what happened in particular ward. Like ward 1A risk level is 15. So we need to concentrate on in which ward risk level is more. So that based on that we can easily sterilize the particular room. Now we are using blockchain audit trial. In blockchain is used for security purposes. Cyber Like cybersecurity in a simulation layer, this blockchain creates a visual sense of immutability, showing that data integrity and auditability are preserved. Like, it means once we enter the data, it should not be deleted and it should not be immuted. So it should not be mutable. Based on that, we can prevent the original data. So this is our model. Like we are using AI insights also, like a high risk period and contact tracing, prevention of success. AI prevented 18 outbreaks this week, like this. And we are having admin dashboard. In admin dashboard, we are using uh, people who are admitted and the doctors in the hospital and main administrator login. And even the administrator or admin can view the system logs in particular time what happened, like a high MDR risk detected in ward 4A, like this. So this is our model, InfectioNet AI. Thank you.